clearly not been balanced. I mean, the FCTC refers to harm reduction, and the WHO pretends like those that authored the document made a mistake by putting harm reduction in there. And we need to remember that when the FCTC was signed in 2003, except for snus, there wasn't really any other risk-reduced product on the market. E-cigarettes only come on in 2013. Nicotine pouches come on around 2017. So there was really nothing at the time that pact was signed. We should also remember that outside harm reduction, if you look at the reduction of smoking in countries like the US, where with the report of the 60s, even doctors had a smoking prevalence of over 50%. So between the 60s and 2003, there was a more than 50% reduction of smoking in those countries. Why did that occur? Based on proper information and proper education, people made informed choices long before the FCTC came into place. So one of the key issues about changing behavior is giving people the correct information. And that is what really irks me, when the WHO becomes the source of misinformation and the source of disinformation, where they've now leaped from saying, not differentiating between tobacco and nicotine. When you go into what happened in the medical profession, nicotine replacement therapy was produced because, as Abbas Raza said, in 76 or in the 70s, people smoke for the nicotine, but they die from the tar. And nicotine replacement therapy came up. Now that there's over-the-counter nicotine alternatives, suddenly, with the WHO watching, nicotine has become the enemy. When, in relation to tobacco use, the greatest way of reducing harm is to be able to obtain your nicotine, but avoid combusting the tobacco leaf. Now, suddenly, because they're changing tech and there's no differentiation between tobacco and nicotine, it's now become a nicotine war, which makes it difficult to talk about harm reduction. So we need to ensure that the WHO is brought to come back to its senses about not telling lies, not supporting studies that don't make sense, not honoring ministers of health that do crazy things like ban vaping. So unfortunately, from where I stand, in terms of misinformation and disinformation, the greatest enabler is the WHO. The public health community is also not helping. You know, in South Africa, we have counsel against smoking. But what it turns out now is that they are against people who smoke. They are not just against smoking, they are against people who smoke, because they'll ensure that people don't get proper information about alternatives that will be less harmful to them. If we're going to promote the harm reduction approach, the emphasis should be on reducing morbidity and mortality, preventing preventable deaths, and do everything we can to ensure that we can save the lives of smokers and improve the lives of people who smoke.